Thank you for asking us to chair the session, which has got considerable relevance to this modern age. Nothing pleases a teacher more than to find that a student is doing well. And I must say this of Balakrishna. And he's going to talk about a subject of which I have absolutely no idea. So I'm looking forward to listening to it.
Respected chairperson and my Professor Krishna sir and former president of GSI, Kaushi sir, and respected patrons of Geriatric Society of India. And I would like, at the outset, I would like to thank Dr. Sajay Sashogan, the National President of Geriatric Society of India, and Dr. Anida Madam for this opportunity. And in the next 15 to 20 minutes, I'll be going rapidly through the role of artificial intelligence in healthcare, specifically focusing to the geriatric care. And there is a rapid escalation of the geriatric population across the world. And we anticipate, or it is predicted that the number of geriatric population in the world will go around to 2.5 billion by the year 2050 from a mere 0.5 billion year in the 1990. And the lifespan of our in India was only 47 years in the 1940s and 50s. Now it is in Kerala, it is close to more than 74 years. And in the Scandinavian countries, it is more than 80 to 80 years. So this poses a lot of, it is a happy thing that the geriatric population, the elderly population is increasing in our society, because their expertise, experience, resilience, and the wisdom is transferred to us, and we learn from there, and it gives us the strength to move forward. So it is a welcome thing. And at the same time, there is a lot of stresses or challenges we are going to face in the healthcare system and the society as well. So one of the most important, as you know, the non-communicable disease, there is a rapid upsurge of the diabetes, hypertension, and other associated disorders. And this multiple comorbidity coupled with the emotional and physical stress which you are facing in this elder population. And as you know, every day the pharmaceutical companies are increasing the price of medication, and they are withdrawing the cheaper medication, going to this escalating price, and the cost of medication. The corporate hospital is also booming up, charging much and much, which cannot be afforded by any person, any patient in our society. And again, the mobility problem, the fatality, the fall, and the nutritional issues, and all this lead. And one of the other more important issues, the lack of or difficulty in adapting the newer emerging technologies, and they cannot cope up the digital system which is going to come. But beyond this, what I think the most important issue is lack of caretakers and loneliness. If we come to our own state, Kerala, which is an advanced education and our literacy is very high, you know that we have got 98 lakh houses in our Kerala, and nearly 14 lakhs houses fully empty, and in nearly another houses, 26.3% of the people are living alone, that is the age, above the age of 70 years in these houses. And the recent data released by the government of Kerala and other agencies have shown that nearly 80 to 9 lakh students migrate out of Kerala. And previously they go to the Middle East and they come back and take care of our parents and things. But these people, 95% of this exodus happening in our state, or the students are not returning to. And this isolation and depressions and loneliness is the major issue which we are going to face in the era. And what we have to do, and we are very unduly stressed, and in this dark spot we have got a silver lining, that is actually the emergence of an artificial intelligence. Whether it will be helpful us or not, that is the issue to be discussed. And when in 1957, when John McCarthy has conceived the idea that the machine may be able to do complex works, training them better than the men, and it was only an extension of a fiction, or we felt it was a story only. But in 1997, I was a tour in a medical, and I witnessed this match between the Gary Kasparov and the Deep Blue machine of the IBM. And this IBM machine defeated the Gary Kasparov, and he cannot move anything. 26 minutes he was stuck into that machine. That showcased the potential of an emerging AI, but still we are a little skeptical about its actual implications or use in our society. But in 2016, when the David Hansen brought about this beautiful Sophia, and many people, I shown this picture in previous talks also, cannot distinguish whether it is actually a beautiful girl working in a medical college or not. So and she's an actual humanoid robotic which can do everything, and this is made us to think the potential or accept the reality that AI is there and it has a tremendous potential. And in 2016, you may not be knowing, in 18, that his sister, that Grace, exclusively designed as a nurse, humanoid robotic nurse to take care of the geriatric population, was introduced in this era. And in the devastating COVID pandemic, this Grace, the nurse, has take care of a majority of the elder population without their need no rest, no, they are not human. And since the positive, I am not going to each and every development which has occurred over the last 50 years in the era of artificial intelligence. But the area, the radio diagnosis, the area which has got completely transformed by the implementation of this AI. When the very moment the patient was secured to the image reconstruction, and even now it has extended to give a pathological diagnosis in the imaging center itself, and not only that, this monitoring the progress and other in artificial intelligence. And this is a comparison which I have done, that an expert 15 doctors, radio diagnostics and other doctors are invited to interpret and detect what is the lesion in this X-ray which is shown. Only 2 doctors were able to diagnose this, but the machine did it almost 99%. And this is the CT scan of the chest which has been diagnosed and missed by the doctor, picked up by this. And your retina macular disease and all the eye diseases in the fingertip, and within a fraction of 1 minute you will get the diagnosis accurately. And 20% higher is the perfection or accuracy of this diagnosis by the machine when compared to that of an expert ophthalmologist. And again, by using a dermalite or a skin vision, you scan this and send it to the system. The AI will interpret what you have got, a melanoma, tumor, nodule, or is it a tinea, whatever. So all the diagnosis will be given by the machine, and they will, the chat GPT of the Sam Altman will give you what the medication should be, then what is the DD, and all the malignancies, breast malignancy and screening of other uterine malignancy, etc. was also being done easily with the implementation of or using the evolving AI technology. Now, beyond our imagination, we saw in the Mahabharata and old epics of India that they make a Maya and all. Now they are going augmented realities and incorporating the virtual reality, and now they are going for a breakthrough in the see-through diagnosis. Now I think the IBM and the GE Corporation, NVIDIA and other companies which is working extensively in the area of artificial intelligence has developed some technology. I'm not telling that this is reaching, but sure, it's not a fiction, it will emerge. Then you will look to the machine, you will see your organ, every organ, and they can see the diagnosis inside, and we need not go for any scanning or something. And this is the augmented virtual reality which is augmenting the area of artificial intelligence. And we recently heard the talk that the polypharmacy is very rampant in in the elderly population, and now the system is going to have a precision medicine in diabetology, wherever it is in any disease. Our aim is to have a particular medicine for a particular disease for a particular individual, either modified by genetics or whatever it is. Now integrating the Human Genome Project and the emerging the artificial intelligence, now they are going to design drugs for the elderly which least adverse effect and ADR which is going to happen. So this is, I want to tell you that how it is going to change our evolving healthcare system. And what I'm talking is not the actual an imagination or a fiction. And now if you look at this particular robotic wheelchair designed by the Keio University, which is already there in that hospital, you see there is no hush and rush of that nursing care people, doctors or running here, and there's a calm and quiet hospital. This robotic chair will come to you when you are getting an appointment in the hospital, and they will invite you, hello, and they will greet you, and they will take you, and they will take the doctor. If it is in the 8th or 9th floor, it is going to open the lift itself, and they will introduce the doctor. And when the consultations come, it will come back to you. It will take to the laboratory, pharmacy, and even probably they will take you to the canteen and give you a goodbye. And I don't know, in the next 25 or 40 years, they will get into the driverless car, which is going to be developed by the Elon Musk. and that is happening, that is there now. And now the newer AI-aided and incorporated codes and bed in the critical care setup in the ICU is going to revolutionize the treatment of the not only the elderly population but everybody. It is a doctor itself. It will identify your pulse, BP, temperature, and everything, and it will give an information to the remote area. Any doctor anywhere in the world can see you, or the relatives can see you, and actually I think this is an amazing thing what is going to happen in the area of artificial intelligence. And our operating system is already, even in Kannur, we have some hospitals now introduced robotic surgery. The Da Vinci system of operation is already there in several hospitals, and we hear the news and articles on what are the issues and other problem which is faced by these operations. And again, the diagnosis and the biopsy can also be done there by the AI radio diagnosis before the patient leave the theater. They will have the diagnosis. You have got ependema or the tumor, meningioma or the mets, whatever it is. And now this is. Now I'm industrial again. I'm talking that the AI is going to influence the healthcare monitoring with the wearable devices and trackers and the medication management, and even it can predict or do a predictive analysis to prevent this fall, and it will help you for your cognitive performance, and it is a real companion now. As I told you, when the kin and kith and the relatives are not there, and now the social robot is you are close, and we have got a film in Kerala that is Android. That one film which has been there, wherein a robot helped a man. And again, the risk assessment, the chronic and predictive analysis. These are all available in the market. That is the emerging AI-powered gadget for the elderly. The video surveillance camera, the medical alternative, and a smart stick for you. I'm not going to talk each and everything and the utility and other aspect of these devices. But you know that all the devices are available, that Alexa and the Google Assistants and everything is available. Now I want to tell that the sensor attached footwear is there. They will tell you the pressure, the speed and pace which you are moving, and whether you, even when you connect to this, the emerging health app, you can predict that after 10 years, you will have a Parkinsonism or something, but they, because of ethical reason, probably that they have got the data. Google Fit may be using, and they are getting lakhs and crores of the data, and the AI, it is the raw material for the development and analysis the data. Now it is the era of the data. They are pulling it and analyzing it. They can even predict. And this is a smart stick which can be used by a blind person. It will tell there is a snake, what is to you that by imagining and doing that. And even recently I read an article that bypassing the visual pathway, if you wear a particular spectacle, you can really see through the things directly go into the calcaneal cortex, the visual cortex, and it will give you an image, and the blindness can be bypassed. We hope for that it will surely come. And again, now in the house itself, the voice control assistants and the powered home automation security system are already there. AI-driven therapy and apps and mental support apps are now available. The entertainment gains are now bidding, and the role of social robotic is being appreciated very well. And now this is the Pepper robotic humanoid report to the companion. They will teach you how to do yoga, how to do exercise. And I know that the son, daughter-in-law, and nobody is there, but he is there always to take care of you. That is going to happen. And again, this is our views that old ladies in our rural area where we are practicing all that. Nobody is there. Previously, the neighbor lady come and talk a lot of. They are very happy. Now nobody. Now they came the Pepper, and they recall the old stories, old events, and they pull the old songs, and they are very, very happy. It is available. The cost is affordable now. And this is a Alzheimer's disease patient as well dementia. They are showing a lot of pictures and what happy days they had in the past, and this is all being transforming the life of this elderly population. Now the logistic and transport and shifting of the patient from a hospital from one bed to other, or taking to the lab and other things, a real cumbersome job which is very, very difficult to manage. Now this the Robier, an expert robot which has been specialized in taking care of the fall patient or taking patient one place to other places and to all other area. Now this is another very interesting area. I was working in a medical college for the last 30 years. And we don't know in the ICU when the patient is comatose or dying, what actually they are thinking. An elderly man, did they think or is completely the brain that we actually do not know. Now the technology, the transcranial magnetic stimulator technology is now recording their thought, and it is trying to digitalize your thought. Whether anything wishes which has been left out cannot be told to the relatives and patients, and now they can interpret it. And now the prototype of printing of the thought is also being now done, and I'm sure that our thought, but the mind to mind communication, that is the miss, that is management information system has already thought the possibility that I can read what you are thinking about me when I'm talking this, and the technology is there already there, but we cannot do that, and that is ethical issue, and probably that protocol of all this management information and taking their thoughts to us is already there. And this is the real AI man who is coming, and he is better than the Spider-Man of our old stories. He can jump, run, and you can do whatever work. He will help in the kitchen, he will do that. And this is the dream project of Elon Musk. And when we thought Elon Musk is having some madness and all, when he talked that he will go to the Mars and come back, but he did that. And he told this Optimus, the prototype which was exhibited in an AI conferences, is the real game changer. And it will come to you, it will help you, it will support you, and all. Now, in every area of geriatric care, this AI is involved, and it has came to that the smartphones and augmented reality, what I'm talking, the telemedicine healthcare, digital healthcare system, and they were lifting and shifting of the patient through the AI-controlled drones and artificial intelligence platforms. And really, we are entering to another world or unimaginable world of artificial intelligence. And they are there, and the David Hansen and other robotic company has already started manufacturing 100 of specialist robotics in every area. So, dear friends, dear colleagues, now this is a wonderful area, and we think that there are somebody who is coming to support us in this time of distress. And but the Elon Musk is the pioneer of AI technology. He partnered with the Sam Altman to develop the Chat GPT. And a later period, he sent all the rockets, everything to the other area. But now he is telling that artificial intelligence is the mankind's great threat, and he tell that he don't want. And he partnered with the Sam Altman also some area. And Professor Jeffrey was the godfather of AI, and he was awarded the distinguished prizes and awards in his discovery. And he worked 50 years in the area of artificial intelligence. And last time he is in an interview told that he want to stop it, all this, and if you don't stop, this is going. And he partnered with the Google also, fearing that all things which you are promoting to care may not be. This is Sam Altman. He is of the view that there is a danger, you have to be extra careful. But when we are moving, science is moving, we have to take the advantage of all this development, and we have to do with the care and what is. And this is one of the most costly picture or image which has been sold for or auctioned into millions in the Western world. That is the parting of a God and the man. That emotional attachment they have. Even the God might have felt a little nostalgia and feeling that when he is sending to the world. And this is by the Michelangelo. This picture shows how compassionate and empathetic and the man and the God and every should be attached. Now the hand has shifted to the machines. Even if the machine give you a very soft touch and it is comfortable, but still I think this will lack that sympathy and empathy and that attachment of the human touch in our life. So we have to go for a 50-50 rule. We can imbibe and adapt all the emerging technologies and that, but at the same time, I think that we should be going to the old system of our companionship, and we should be with our parents till we can have whatever the machine comes, or we have to do that. I'm not sure that will happen or not. That is my ambition. That is probably many of your ambition. Thank you. I think I've finished in time also. Thank you very much.
Thank you very much, Dr. Valliyot, for your elaborate discussion. Friends, we know about geron technology. So artificial intelligence is also a technological advancement, and nowadays it is widely used and also practiced. So what I know that artificial intelligence is not superior to human intelligence till date.
No,
Then
sir.
I have a comment.
No, sir.
Okay. artificial intelligence has process. All processes are elaborated. There are cons also. It cannot still till it deals with the emotions of the persons. So, in terms of regarding geriatric care, the emotion, the sympathy and empathy is required for our caring the geriatric population. So, what I want to say, to match the requirements of the elderly with the advancement is required now, and also human touch is required.
Yes, sir. And now whether that issue, whether the machine can think more and do works more and than the human brain is a issue of debate. But the AI is now in the initial stages, then they anticipate that there will be 10 stages of the development of AI. We are in the second or third stage only. When we cross it, machine will overtake you in thinking and they will disobey your commands and they will have the round. And even an interview with the Sophia, when it was launched, it was asked that what you like to have. Do you like to have marry any beautiful man or somebody? That was the question. But I don't know whether that is a wrong answer or not. He told, I don't want to get married, but I want a child like me. That means this is the process. I'm sure that in the evolving area, the human brain is what is so limitation, and the limitation can be bypassed because we are going to the generating data and data, and when the data, it is just like pouring oil into the fire, and they will go and interpreting the data. They will develop their own idea. They will have their own. They will disobey you also. Even the NASA told that you should. NASA was asked to told the next line of quantum experiment in NASA because supercomputers come in. Now we are using only simple computer even for the AI. When the supercomputers come, we ask for 10,000 time more processing capacity, and that will we cannot know what should be done. But again, the Google started the research again, bypassing all these objections. So in some era, they are telling that in 2100 or 50, that is 50 or 70 years, and they will rule the roast. Will
Thank you.
challenge the humanity. That
Thank
is.
you, Balakrishna, for taking us through the realms of science fiction back to terra firma. I have a question for you. When there is such a lot of artificial intelligence analyzing data, be it of the brain or of pathology or something, I have Dr. Shaji here too. Will it not breach confidentiality?
Yes, sir. That is a lot of things which are already there, which they want to develop, has been withheld because of the ethical and other concern. And even now, if we go for and talking about artificial intelligence, the major issue discussed is the ethical issues and other area. To what extent we should promote, we should stop it, and this is a major issue which we cannot. So, if you want to go for the advancement in our life and in the science, we cannot stop it to some. And if you don't stop it, this will have erode your privacy. And sir, if we are walking in the morning for as a part of exercise, we are using the Google Fit and all, and they are developing my data, how much calorie I am spending, and what is the space I which and it has everything what I do every day is with them. It is already with
any
God.
burning questions?
I think, sir, we are running short of time. We can invite them.
But then you can't answer your own question. There must be questions on the floor.
So I have strictly prevented everybody going extended time, and I really apologize that it was due to compulsion, and I don't want to extend this beyond it. So, if sir permit.
Any questions? No. You want to ask a question? Thank you then. Brilliant session. Thank you.